Is it realistically possible to achieve your pre-pregnancy body back after you've had a child? Lot of women come seeking the answers to my office, and the answer for them is a mommy makeover surgery. Of course, with pregnancy and childbirth, it's the most demanding time in a woman's life, and there are challenges at various fronts: emotional, physical, getting back to your work life after you've had a child. So of course, the challenges at various levels bog one down, and they start looking upon themselves as somewhere they feel that they have to get back in shape, and it's not an easy task. I'm Dr. Shilpi Bhadani. I'm a plastic and aesthetic surgeon at SB Aesthetics, Gurgaon, India. Mommy makeover is one of the most common surgeries in our practice. So what is a mommy makeover really, and what does it do? If we look at the most common changes that are brought about by pregnancy and childbirth is in the abdominal area and the breast area. And these are the most common changes that women will require after their pregnancy and childbirth if they want to get back to their pre-pregnancy figure or pre-pregnancy state. Now when we look at the changes, usually in the abdominal area, what happens is that this area of the abdomen, it will sag and the navel will droop somehow. The flank area also becomes slightly fuller, the waist area becomes a little less defined. There are changes in the breast, and these changes can be increase in the breast size, sagging, or in fact even decrease in the breast size with sagging. So of course the situations that they come up with is very widely varied. But if we group together mommy makeover, it is basically about changing the size or shape of your breasts and changing the size and shape of your abdominal area, and this constitutes the core of a mommy makeover procedure. Now when we look at the changes that the mommy makeover surgery brings about, so when we look at the changes in the breast that has been brought about is the sagginess of the breast is changed to a more uplifted looking breast. The nipple position have changed. From here you can see that the nipple was slightly saggy downward looking, and here we can achieve an uplifted position of the nipple. Now in the abdominal area also, a flatter profile of the abdomen can be attained with the mommy makeover procedure, and the waist definition can be attained as well. This can be done in a single surgery. Now when we look at the front view of the same patient, from the front view we can appreciate that the waist definition, or in fact because of the sagging breast, we can hardly see the waist here, but that is possible to uncover by the upliftment of the breast which has happened, and this has happened by a lollipop scar, which is a vertical scar reduction method of the or vertical scar upliftment method of the breasts. In the same session we can also reduce the breast or augment the breast if we want to. Here you can see that the change that has been brought about is a well defined waist and a much flatter looking tummy. The navel also has been repositioned, and the scar, if you can make out, is right here, which is well hidden within the underwear. In the second case, a similar one, if you see, the changes that have been brought about have been put together in this slide, and these are both before images. And here you can see that again the breast is saggy, downward pointing, lot of stretch marks in the abdomen, and many women will come with this concern also that, doctor, what do I do about stretch marks? And believe me, there is no sure shot non-invasive method which will give you complete cure from your stretch marks. If you can see in the frontal view also, some stretch marks are there above the navel, and of course more prominently in the lower part, and there is slight sagging in the lower part. Now if we do only liposuction for these patients, which many times we do, depending on how we select our patients, the success rate varies. In this case, if we do only liposuction, of course the size is going to shrink, the waist can be more defined, but all the sagginess that we see in the lower abdomen, which in this particular patient she was concerned about, and this sagging cannot be improved only with liposuction. That is why when we do a tummy tuck, we also repair the muscles and the abdominal tightening happens. So in the next figure you can see that the bulginess of the abdomen, which was there initially, which was like this, has been straightened out, and this is achieved by a tummy tuck or an abdominoplasty procedure. Again, in the second figure, the frontal view, you can see that much more defined waist, an uplifted breast, a repositioned navel, and the scar is lying over here. So, the scars are not visible. In the breast also, the scars fade away a lot with time, and breast is not one of the areas which will scar badly. So, a lot of time patients will come with the concern that, doctor, I don't want any scars. So, again, if we want a big change, then we have to put up with some kind of scars, but again they actually fade away with time, and we teach the patients how to take care of their scars. They can come down for laser sessions and so many other therapies that are available for decreasing the scars. But believe me, they are not very prominent. Even in this case, you can see that the scar just at 3 weeks time has already started to fade away. When we consider the back shaping, that can also happen with a mommy makeover procedure, and here you can see that the heaviness in the flank and the lower back area that came with pregnancy and childbirth, and even the upper back which was heavy, we've been able to sculpt in the same procedure and have given her a well defined waistline, a reduced flank area, a smaller upper back area also. So, overall the entire torso can be redefined in a mommy makeover surgery, and it's a very successful surgery, a very in demand surgery, because a lot of time women struggle post pregnancy with losing their weight, getting back into shape, tightening their muscles, and sometimes the rectus divarication is so huge that it cannot be just toning up that can be done. It actually requires a proper surgical procedure where we bring in the muscles together, and it's actually a strengthening procedure, because when the rectus muscles, they are separated, when the patient or the person stands erect, what happens is that the intestines, they will bulge out of that weakness in the abdominal wall, and that is what we repair in the mommy makeover surgery. So, it's a wholesome surgery. It's actually an improvement of the entire torso, the breast and the abdomen. Of course, there is certain downtime associated with it, and that needs to be taken into account. You should have enough rest days after the surgery, and you should have someone to take care of you. If you have any questions regarding mommy makeover surgery, or you are considering a mommy makeover surgery and would like to understand a little more about it, drop your questions in the comment box below and we shall be very happy to answer them. I hope you found this video useful.